The Korean Regulatory Authority is undergoing procedures to revoke the medical practice licenses of over 7,000 interns and resident doctors who have resigned from their positions, affirming that the penalties are irreversible. On March 4th, Mr. Park Min-soo, Vice Minister of Health and Welfare of South Korea, announced in a press conference that the government would verify the presence of doctors at workplaces and cross-reference legal provisions and regulations, especially regarding collective resignations, causing turmoil at healthcare facilities. Strict and swift measures will be taken against involved parties. Mr. Park Min-soo emphasized that if interns and resident doctors are involved in defying the government's order to return to work, the penalty of suspending medical licenses for a minimum of 3 months is unavoidable. Those whose licenses are suspended for 3 months will be unable to meet the professional training period, resulting in a delay of at least 1 year in obtaining a medical license. Additionally, administrative penalties and reasons for the penalty will be recorded, potentially adversely affecting future employment. February 29th was the deadline for exempting penalties for those who resigned during the recent healthcare crisis in South Korea. An inspection of 100 major general hospitals in South Korea revealed that as of 11 a.m. on February 29th, a total of 8,945 interns and residents had left their jobs. By February 28th, a total of 7,854 interns and resident doctors had received the government's order to return to work. Mr. Park Min-soo also stated that, although February 29th was the final deadline for exemption from penalties, the government would commence on-site inspections from March 4th. Therefore, if anyone returns to work before the inspection, the government will consider it favorably. If during the March 4th inspection it is confirmed that they have not returned to work, those involved will be penalized and notifications will be issued by March 5th. On March 4th, the Ministry of Health and Welfare of South Korea dispatched staff to 50 hospitals to inspect the return of interns and resident doctors to work. In the evening of March 3rd local time, doctors from across South Korea gathered near the National Assembly of South Korea to organize a large-scale protest to continue expressing their dissatisfaction and opposition to the government's healthcare reform policies, such as expanding medical school admissions. Prime Minister of South Korea Han Duck-soo declared on March 3rd that the government would not yield to collective resignations which put people's lives at stake. If doctors leave the medical field illegally, the government will fulfill its obligation to protect the safety and lives of everyone. Mr. Han Duck-soo also announced that starting this week, the government will initiate preparations for a special committee on healthcare reform, as well as establish a special committee on healthcare reform under the president's authority as soon as possible, and develop detailed implementation plans for related healthcare reform policies. In February 2024, the South Korean government announced plans to expand medical school admissions, which has been vehemently opposed by medical associations and medical students, leading to a sustained wave of resignations from resident doctors and interns up to the present day.